So thalassemia is a condition where there is a genetic defect in the hemoglobin production, as a result of which there is less RBC production, there's increased destruction also, and as a result of that the child requires monthly blood transfusions for life, starting generally between the age of 6 months to a year. Now, once you go on giving blood transfusions, there are issues associated with it. There are infections which can be picked up. There's iron overload which comes up. And eventually, there is iron deposition in various organs affecting their organ function, which then leads to a early mortality in these subset of patients. Now, obviously, prevention is the first thing we should focus on, and identifying thalassemia carriers is an important thing towards that step. So whenever somebody has low hemoglobin, we should not take it for granted that it's just iron deficiency and give iron tablets. It's good to test and find the reason for it. If you pick up somebody as a thalassemia trait or carrier, it's good to check the spouse and their siblings, so that if you can prevent a thalassemic child being born, then it's a big thing to actually achieve from a preventive perspective. Now, if two people with thalassemia minor are planning to have a child, you can still go ahead, have antenatal diagnosis to find out whether that affected child has thalassemia major, and then take a call to actually prevent this disorder. Now, once diagnosed, like I mentioned, the only treatment then becomes transfusion. Other than that, bone marrow transplant is the only curative treatment, provided there's a donor available. The donor can sometimes be a sibling, or rarely nowadays with the haplotransplants, it can also be a half-matched parent. And you can also find an unrelated donor who can sometimes then donate these cells, and these can be utilized to undergo a stem cell transplant, which is the only cure for thalassemia. Research is currently going on towards gene therapy in thalassemia, and which, if things progress and becomes available for our population, it will be a nice way to actually cure this disease using gene therapy. So for the time being, let's focus on prevention of this disease by trying to do as much screening and pick up the incidence of carriers in our country and community.